Now we're going to take a look at the functionality of the Tempus Pro. So I've got the Tempus Pro set up here in patient demo mode, but you can see I've got all my consumables and leads connected as if it was connected to a patient. So I've got my ECG readings, my SATs readings, my capnography, I've got my patient temperature, respiratory rate, and my non-invasive blood pressure if I choose to use it. So we're going to talk about the ECG first, and if you want to have a look at any of the different parameters or settings within each of your vital signs, you're just going to tap one of the boxes there. So for ECG, you can see here that it brings up all the different options that we can look at and adjust. So we can look at our heart rate limits, which are our alarm settings, which leads that we want displayed on the vitals main screen. We can look at our waveform selection, our heart rate source, and we can also perform a 12-lead ECG from this setting. We can look at arrhythmia analysis and look at ST or QT analysis, and the Tempus Pro will give you a clinical recommendation of what's happening with the patient. So even if you're not clinically familiar with what you're looking at, the Tempus Pro can give you an idea of what it is you're seeing with your patient. So for the purposes of this then, we've connected our 12-lead ECG. Normally the patient's on their 5-lead, but we've got a 12-lead ECG here, and I'm going to click View. And now you can see the screen has changed, so we've got what you would normally be used to seeing as a 12-lead ECG. Obviously we can have a look at that on the screen, so if you had a patient who had chest pain or anything clinically indicating of a 12-lead ECG, you can see what's going on. And we can also start records. We can do screenshots or we can record. So I'm going to click that, and it's going to come up with a timing bar on the right hand side where it's demonstrating that the recording is in progress. Once that's complete, it's come up with a snapshot there, and it's going to save that within your summary record of care or your SROC. If you click here on interpretation and review, it will show you what the Tempus Pro interprets the ECG looking at. So you can see here that it's saying that it's a normal sinus rhythm with normal morphology. So you know that you're looking at a normal ECG. We're going to click back, click the home screen, and it's going to take you back to your vital signs menu. Okay, so now we're going to look at our oxygen saturation. So again, if you want to look at anything within your pleth cable, you're going to click on the blue menu on the right hand side there, and it's going to give you a variety of different things that you can change, including your saturation limits and also where your heart rate is being sourced from, heart rate or pulse rate. You can look at it from your ECG or you can look at it from your pulse oximeter. You can also change the size of the waveform. So if I click on and go back to the home page, you can see that it's just changed the size to it being slightly larger. I'm going to turn that off again, and you can scroll through the menu and it will just give you some indications of all the things you can change. So you can change the sensitivity mode, the averaging time in seconds of what's displayed on the screen, your cardiac wave speeds and your beat volume. Once you're happy, click back or click the home button and it will take you back to your vital signs. Now we're going to look at the non-invasive blood pressure monitoring. So again, your non-invasive blood pressure is on the top right hand corner, and just the same as we did with the ECG and the SATs probe, we're going to click on the non-invasive to get our menu options. So we can look at the mode, whether it's in manual or auto, and we can set the interval time in minutes as to whether we want it to automatically keep cycling. It's going to give us our alarm parameters as well, whether we want to set it by systolic, mean or diastolic, 1, 2 or all 3. And it's going to give us the option to change the initial inflation pressure and the reading format. So we can just cycle the blood pressure and you can hear it kick in. And if at any time you want to stop it, you just click stop. If not, it will complete the cycle and measure the non-invasive blood pressure of your patient. Once that's complete and you're happy with your settings, click the home page button and it will take you back to your vital signs. We're now going to look at the capnography settings. So same as before, we're going to click on capnography and it's going to give us all the different things we can adjust. It's going to give us our alarm parameters for respiration limits and how long before it'll alarm when it detects there's been no breathing. As you can see there, it's set to 30 seconds. We can set our end tidal limits, which will obviously vary whether the patient's ventilated or not. We can look at our wave range and our respiration wave as well. Our operating mode can either be normal, we can pause it for 5 or 10 minutes, and once we're happy, we can click the home page and go back to our vital signs. Okay, looking at our temperature parameters, again, we're going to click on the temperature box in green, and it's going to give us the options for what we can adjust. So we can look at the temperature units in degrees Celsius or degrees Fahrenheit, and we can look at our 2 temperature port limits and set a lower and an upper threshold for when it'll alarm, as well as our delta limits. Once we're happy, we're going to click back or click the home button, and it'll take you back to your vital signs. For the purposes of demonstration, obviously I don't have a patient connected with invasive lines, but you can see here that once we connect our invasive pressure cable, it changes one of the ECG traces to a pressure line. Again, the same with adjusting any of the vital signs. If I want to change anything within this, I'm just going to click on it there. And the first option it's going to give me is channel configuration, and we can adjust it so we change the channel label to say an arterial line, a central line, or ICP monitoring. I'm going to select art line and save it and go back. Then we've got other options like we can zero our transducer, which we're going to do as part of our safety checks and our 373s. We can adjust our systolic, mean and diastolic pressure limits, and we can also adjust the cardiac wave speed. Once I'm happy with all of those things, I'm either going to click back or the home button to take me back to the home page with all our vital signs. In each of the vital signs, you can also look at trends of each individual parameter. So say, for example, I look at ECG. Along the right-hand side, and this applies to all of your vital signs, you can click trends, and it will come up with a graph with a time bar across the bottom of all the different heart rates that sits across that timeline. You can click across the bottom, you can highlight up to 2 at a time, and it will track your trends as to how your vital signs have changed over a select period of time. Another important thing to note is that whilst I've demonstrated all of these things using the touchscreen menu, if for whatever reason you were unable to use this function, you can click on the menu button, click on medical parameter settings, and it gives you the options to adjust all of these things using the home menu button. We are back onto our patient demo mode, and we've got all of our connectors here with our vital signs, as you can see on the screen. On the top of the touchscreen there, you can see that the patient name is not set, so we want to change that. So if you click this button here with the 3 silhouettes on the bottom, it gives us 5 different options from patient details, discharge, admit patient, switch to a previous patient, medics, and the end of our shift. So we're going to go into patient details, and I'm going to click on name. So I'm going to call this patient Adams, and then Andrew. And as soon as those details are entered, it will save it. So I'm going to click back. Or I can go back into patient details, and then it's going to give me the options of all these different things across the top. So for age and sex, the patient is an adult. The age, I'm going to call him 25 years old. And we've got a male patient. If we click on weight and height, it gives us the options of weight in pounds or kilos and height in centimetres or inches. So for weight, I'm going to decide that the patient is 70 kilos, and for height, the patient is 185 centimetres. And again, once that data is inputted, it does save it. So the patient's ID number, obviously that's the best way to identify. So we need at least 2 points of data, so a date of birth, an ID number, and a name. So I'm just going to input the patient's ID number there. And it gives us the option to input any allergies. So for the purpose of this, Andrew is allergic to morphine. Along the top bar here, we've also got the option to input events. The summary button is the summary record of care, or SROC. You can see your trends and your tables. So we're going to work through all of these now. So on the events, it gives you lots of different options of things that you've administered to the patient. We've got general options here, assessment, interventions, fluid, drugs, and body maps and burn scores. So we can say, for example, that we gave coamoxiclav. It's not going to give you the options of specific doses or anything like that, but it's recorded there that on this day at 15:57, we administered coamoxiclav. If we go on to the patient assessment, we can identify all of these different things which will be logged in the SROC, ranging from catastrophic hemorrhaging, clear airways, airways obstructed, or C-spine clearance or suspected injuries. On interventions, we can document whether a tourniquet has been applied, whether a hemostatic dressing has been applied, or whether a pelvic binder is in situ on the patient. We can document the type of fluids they've been given. Again, it's not highlighting specific volumes, but you can highlight that you administered Hartmann's. We can also document that we gave certain drugs. So for the purpose of this, I'm going to document that we gave some amiodarone. And if you click on the map or score button, it gives us different options, including GCS, injuries, burns, dressings, and a TQ map. So if I'm going to click on the burns map, it gives us the option for a front and rear view of the patient, and all you do is tap across the screen, highlighting which degree of burn that you believe the assessment is for, first, second, or third degree. So I've highlighted first degree burns, and I'm going to document that down the patient's left-hand side, we've got some first degree burns. I can also calculate the burns area and input data into there. So I'm going to say that that is 15% total burn area. And again, once that data is inputted, it will save it and click back. What you'll be able to see then is if I click on the SROC, the summary record of care, it will highlight all of those things that I administered or did. So we gave coamoxiclav, I gave some fluids, we gave some amiodarone, and I also logged a burns map. So once your patient details have been inputted, you can scroll across the other menus across the top. So we can look at different events, and here it will tell you whether we've got page, start again. So once we've inputted all of our patient details, we can use these extra bars across the top and explore different options for the Tempus Pro capabilities. So if we look at events, it's going to give us a range of different options that we can do: general, assessment, interventions, fluid, drugs, or a body map. So it tells us here that we've got page 1 of 3. So if I use the up and down arrows, it'll give us different options of general interventions that we can do. Assessment, we can look at things like catastrophic hemorrhage, obstructed airways, respiratory arrest, a deviated trachea, hemothorax. We can look at interventions including tourniquets and hemostatic dressings being applied. We can also assess whether an airway's been inserted or whether head blocks have been used. If we look at our fluid menus, we can look at anything like normal saline, Hartmann's, or whole blood. If we want to select whole blood, we can add different notes to that. So we can document the batch number or the expiry date of the blood products that's been used, and that will all get recorded in the summary record of care. So I'm just going to type something in so that it records it. Okay. We can look across to drugs. Again, it's giving me the indication that I've got pages 1 of 3. So I've got lots of different things that I can give. So I'm going to give a dose of coamoxiclav, and again I can select notes and input 1.2 grams, which comes up as a separate note. And once that information's typed in, it will be logged on the summary record of care. So I can click back. If I click on the body map, it will give me different options, including GCS, injury, burns, dressings, and a TQ map. So if I go into the burns map, I've got 3 options here, whether it's first degree, second degree, or third degree burns. I'm going to highlight that it's first degree burns, and I'm going to record that the patient has burns all the way down the left-hand side of their body, with a total burn area calculation of 15%. So once I've inputted all of those events, I can go into the summary button, which is also known as the summary record of care, or SROC, and it will give me all of the data and all of the events that I inputted. So we gave whole blood, and the note that I added there. We gave co-amoxiclav and I added a note that says 1.2 grams. I took a waveform snapshot, which is on the vital signs homepage, and a single press of the waveform snap button, and you can see that there. And if I click on it, it brings up the waveform that I was looking at the time. I click back. I've also documented there that my airway was clear and my C-spine has been cleared, and then I took another waveform, which I can then look at again and see my vitals trend at the time. Once I'm done with all of those things, I can click the home button and it will take me back to my vital signs screen. Let's have a look at some of the other patient functions on the Tempus Pro. So if you click the membrane button at the bottom with the 3 silhouettes, you can see here at the top we're still looking at Andrew Adams as our patient. We can do things like adjust the patient details, discharge or admit the patient, switch to a previous patient, input my details as the medic, or mark the end of my shift. So I'm going to switch to a previous patient, and you can see there that it brings up a list of other patients that have been monitored using this particular device. So I'm going to click on Brian Bates, confirm my selection, and it's going to give me the vitals trend for Brian. Obviously I would have changed my leads to Brian as well. I can apply interventions, record events, track waveforms, Burns maps, all of those different functions that we've discussed before. I can do all of that, and once I'm content that I've assessed Brian and everything's up to date with him, I can go back into the patient menu, switch to a previous patient again, go back into Andrew Adams and confirm my selection to look at Andrew Adams's summary record of care. So if I wanted to record my own personal details as the person in charge of this patient's care, I can click on the 3 silhouettes at the bottom on this membrane function, click on medics, and then I can input my own details there. Once I'm happy with that, I can go back to the home page. If I wanted to input any other details, you can click on the notebook pen across here and it takes you back to this menu where you can look at your events and your SROC. I want to look at table, which will give me a vitals trend of my patient at varying different time intervals, which you can see highlighted there at the top of the menu. And it just gives you a snapshot of all the different parameters that you've been looking at over a select period of time. Once we're happy with that, if you've got nothing else to input, you can click the home page and go back to your main menu. Now let's look at the different ways we can send data from the Tempus Pro, which is a great functional feature on this particular bit of equipment. We can do it in a variety of different ways, including using USB memory devices, which are plugged in using the 2 ports on the right-hand side of the screen here. We can utilize an external printer, an email address, which allows us to send a patient report as a PDF or as an electronic patient care reporting system. Or we can use an internal printer, which some of these devices have built into them. It's just important to note that within defence, our reachback capability can often be affected by our area of operations or the functionality of how the equipment was procured. We're just going to explore the different options in the main menu button here. So if you press that blue button, it's going to give you 4 different pages of options of things you can look at. So there's lots of different ways you can access all of the things we've discussed so far in this video. So you can see here, you've got your medical parameter settings, your summary record of care or SROC, your waveform snapshots, display menus, patient menus, data input or output, how to access the camera or the eye assist, how to manage your Wi-Fi networks and GPS locations, your maintenance and settings, and also that demonstration mode which we've been using throughout this video.